Welcome to Health Currents. Our guest today is Dr. Philip Hayes, a cardiologist. And welcome, Doctor.
Thanks for having me.
Appreciate you being here. And today we're going to talk about heart failure. What exactly is heart failure?
Well, heart failure is basically a condition where the heart is incapable of providing normal amounts of blood and oxygen to the other tissues or organs of the body. In many cases, patients who have heart failure, where they're pumping less blood, they will feel tired. They may not perfuse their kidneys as well, and as a result, they may make less urine and start retaining fluid. And the majority of patients with heart failure also notice some amount of getting winded, especially when they exert themselves early on. But then some patients, unfortunately, with more advanced forms of heart failure may have shortness of breath even at rest.
Sure. Doctor, I understand Riverside has a heart failure clinic. What exactly is that, and who is that designed for?
Well, this actually the heart failure clinic started as an infusion clinic for patients with end-stage heart disease. However, the hospital has found it extremely important to have patients that have rather severe heart failure be seen in the heart failure clinic with the approval of their attending physician. And the things that are stressed on those clinic visits are whether the medications are being taken appropriately, whether the patient is weighing themselves to determine whether they're gaining fluid weight or not, and whether they are having any sort of intercurrent symptoms that might suggest some deterioration of their heart disease.
So what is there a connection between heart failure and heart attack?
Yes, the majority of patients who have heart failure probably have it on the basis of coronary artery disease, which we know is a big killer in this country. And we've gotten better at avoiding patients dying when they come to the emergency room with a heart attack. If they arrive alive in the ER, generally they have a very good likelihood of surviving that illness. However, as a result of damage to the heart, if there has been any significant damage, they may be at risk of developing heart failure later.
The heart is a muscle, so is there a way to strengthen that muscle if it weakens through heart failure?
The best way to do that is by using medications that have been shown not only to improve symptoms, but to improve survival in patients with that diagnosis. It's not clear that physical exercise necessarily strengthens the heart, but that being said, physical exercise does have benefits to the muscles that are trained, and in many cases, exercise is a useful adjunct to pharmacologic therapy.
Sure. So through the management of this disease, it sounds like medications play a big role.
Yes.
What other management tools are there for someone who has heart failure?
Well, lifestyle modification. We ask patients to look at modifiable risk factors such as smoking cessation, such as getting their blood pressure under control, their diabetes under control, their hypertension under control. Those things that can be modified, if they're done so successfully, then patients have a lesser likelihood of disease progression.
Right. And to those of us who are fortunate not to have this, the good indicators would be to continue to live a healthy lifestyle. So
that is correct.
All those things you said, do all the healthy things, don't do the bad ones.
That is correct.
General rule. Okay.
And that would go for weight reduction and for physical activity as well.
Sure. Well, Doctor, before I ask our last question, we're going to go to Judy and get a Health Currents update.
Thanks, Carl. Heart failure affects nearly 5 million Americans of all ages. Riverside Medical Center's Heart Failure Clinic is one of only 2 clinics in the state of Illinois and one of 22 in the entire U.S. to have earned the heart failure accreditation. The clinic team includes specially trained cardiac nurses as well as collaborating physician Dr. Hayes. Heart failure program coordinator Liz Worth recently received national certification as a heart failure nurse. And coming up in September, just remember no 2 knees are alike. Join Oak orthopedic surgeon Dr. Rajiv Puri and Riverside Medical Center to learn the latest about computer-guided knee surgery. Thursday, September 27th at 6 p.m. at the Riverside Health Fitness Center. And back to you, Carl.
And for our final question, Doctor, I wanted to ask if somebody is feeling some of the symptoms that you've described, what should they do?
Well, I would hope that they would go see their physician. If they don't have one, there are a number of good physicians in this community that will take patients and will be happy to take a look at the patient's symptoms and do a physical examination and decide whether any sort of evaluation would be appropriate under those circumstances. The workup, in addition to a physical examination, would probably involve some lab work, a chest x-ray, an electrocardiogram. In this country, and with the insurance the way it is, I think patients can seek an opinion from a cardiologist without going through their primary doctors, but it may not be necessary.
Very good. Dr. Philip Hayes, cardiologist, we appreciate you joining us today on Health Currents and appreciate all the good information.
My pleasure.
And we ask you to stay current, stay healthy, and stay tuned to Health Currents from Riverside Medical Center.